Hi everyone, we are Team Memorial Sloan Kettering. This is our disaster plan for Memorial Sloan Kettering Cancer Center. Our team members are Christina, Maya, and Janie, and this is for our Emergency Preparedness for Healthcare Organization course. New York City is called home to more than 8.5 million people. Being the most populous and densely populated city in the country, it is also the financial, cultural, and media capital, as well as a very popular tourist attraction. The city is divided into 5 boroughs: Manhattan, Brooklyn, Queens, the Bronx, and Staten Island. Besides being located on one of the world's largest harbors, it is surrounded by 2 rivers, with the Hudson River and the East River. For a number of reasons, the city is vulnerable to threats like severe winter weather, snowstorms, extreme temperatures, hurricanes, heavy rain, thunderstorms, flooding, epidemics and outbreaks, terrorism, fires, utility disruptions, accidents and crashes, cyber threats, and many more. High urban density and larger amounts of combustible material are present in these buildings, making them susceptible to fire, which can spread very easily and affect many people. Any incident or issue within public transportation can cause disruptions and safety issues as well. Outbreaks spread easily due to high population density. The city has experienced many major and minor emergencies in the past, for example, the 9/11 attack, Hurricane Sandy, blackouts of 1977 and 2003, the World Trade Center bombing incident, a number of outbreaks, bioterrorism attacks like anthrax, and any occurrence of these emergencies can immediately impact lives, day-to-day activities, and critical functions throughout the city. These events can be escalated even further within a hospital setting as critical operations are disrupted and patient care can be immensely inhibited. Thus, hospitals have to be ready to tackle the impact at a moment's notice and uphold the workflow to run as normal as possible. Memorial Sloan Kettering Cancer Center is located in New York City. The facility is the part of the Medical Center and Medical School of Weill Cornell Medical College. Attendings, residents, and fellows all have affiliations and teachings with this hospital. It is a JCAHO accredited hospital and a member of the National Disaster Medical System, also known as NDMS. The facility has a total of 473 licensed beds. The hospital has 3,955 clinical staff employees, 11,638 non-clinical staff employees, 3,955 licensed practitioners, and 1,734 residents. The center has a total staff number of 15,697. There are 5 non-hospital based clinics affiliated with this hospital. Memorial Sloan Kettering Cancer Center uses the NIMS Compliant Hospital Incident Command System, also known as HICS, that is flexible to specific needs of events. It is coordinated by a unified command structure when appropriate. It is integrated with local, state, and federal incident command processes. They have a designated incident commander, including primary, alternate, and second alternate coverage for HICS positions, which is established for incident commander succession plan. It is exercised twice annually, and there is an after-action report or improvement plan, which describes that AAR will be completed within 30 days following the post-incident review. It will be done by the emergency management team with incorporation with key stakeholders. Memorial Sloan Kettering Cancer Center has a well-defined organization of primary and alternate hospital incident management teams. Also, their plan clearly defines roles and responsibilities of key leadership staff during emergencies. It is also described with certain information on where to report and where to identify gears during that event. For establishing the Hospital Command Center, Memorial Sloan Kettering Cancer Center has a designated room for the primary command center, which is located in a secured location. And if the primary command center is not accessible, the secondary or alternate command center exists in the facility. ICS command staff has an adequate, predefined, communication system, and each section chief has a dedicated phone line. HCC is equipped with telephones, satellite phones, fax, two-way radios, janitors, maps of the hospital, copy of the emergency management plan, and other necessities. As we talk about the four key elements that we think are critical for this disaster plan, we first come across two elements that could be combined. Element 5, which is communication, warning, and notification, and Element 20, which is mutual aid agreement. Communication is the key component of emergency management and response. Memorial Sloan Kettering Cancer Center has a detailed communication plan on how to manage internal and external communications during an emergency. Internal communication during any event of emergency, the incident's commander guides the public information officer or designee for notifying the center for HICS activation. For that, overhead announcements for immediate life safety threats, center-wide email, intranet announcements, and messaging to personal communication devices, for example, cell phones, pagers, walkie-talkies, will be used for notifying the staff. The staff will also be notified using Easy Notify, which is a mass communication system, as well as alternate methods like radio or television by the public information officer. For staff communication during emergencies, Memorial Sloan Kettering Cancer Center advises the staff to limit the use of cell phones. They have provision for red disaster phones if the regular phone systems fail, with the red phone directory with numbers available on the website as well as on paper copy. For external communication, on the activation of the disaster plan, the appropriate external authorities and community partners will be notified by Memorial Sloan Kettering as required. For mutual aid agreements, Memorial Sloan Kettering Cancer Center unites with the Greater Hospital of New York, and they are affiliated with other centers such as NYU Langone, New York Presbyterian Weill Cornell Medical Center, as well as Memorial Sloan Kettering Cancer Center. There is a large healthcare facility directory, and the facility participates in the New York State DOH Hospital Emergency Reporting Data System. The mutual aid partners for Memorial Sloan Kettering are New York Presbyterian Weill Cornell, as well as New York University Langone Medical Center. The next element that we find critical to this plan is Element 10, other hospital capacities. This center uses the NYPH ambulance as well as patient shuttles, air travel, and van services for patient transport. The facility does not have any on-site or temporary helipad or heliport services. Memorial Sloan Kettering Cancer Center has the Biosafety Level 2 lab, a morgue capacity of 21, and availability of portal cardiac monitors, x-rays, sonograms, and ventilators, as well as the capacity and capability to provide radiation therapy. The final element that we find critical for this disaster plan is Element 17, training, drills, and exercise. All Memorial Sloan Kettering Cancer Center staff receives orientation to the emergency management plan and complete annual training and education in the CBRNE. The emergency department staff receives at least twice annual training on response to chemical, biological, radiological, nuclear, and explosive events and participates in at least 2 annual mass casualty exercises. All clinicians receive annual CBRNE training and maintain current basic life support registration, and non-clinicians receive annual CBRNE and emergency preparedness training. Emergency management plan is exercised at least twice per year. Exercises are conducted once a year, including one community-wide exercise. Drills and exercises take place on all shifts, on all units, and include all facility departments. If we had more time and more resources, there are a few improvements we would try to make within the facility. Currently, Memorial Sloan Kettering Cancer Center does not have a helipad on site. Trying to equip the facility with a helipad and helicopter service will really help during emergencies. As mentioned in the lectures in an interview, the interviewee mentions having posters on hospital doors and walls for guidance during hands-on emergencies to help individuals who cannot fully remember the steps in emergency preparedness. Having posters around the hospital will be very helpful for those in immediate need. Having more connections to outside facilities such as fire and police departments, other hospitals, and smaller clinics and practices can help when it comes to evacuating patients and they need to be placed somewhere where they can seek immediate care. Overall, Memorial Sloan Kettering Cancer Center is a very strong facility with a mission to help every patient in need. They are well equipped with all of the necessities for a disaster. A strong point to take away from this during any emergency preparedness situation is the training that is provided to all employees. Hands on and online training is very important for all people within the hospital so that they are confident in handling situations in the event that there is an emergency. Another key concept to take away from not just this plan, but in emergency preparedness altogether, is communication and teamwork. Communication and teamwork are important in the public health field as well as the healthcare community. Without communication or teamwork being put into use by hospitals, clinics, and companies, there would be no sense of direction when coming encountered with an emergency. Since the goal is to execute the most effective way possible to relieve the emergency, communication and teamwork play a very significant role in ensuring that. And here are a list of all of our references. Thank you so much, and we hope you enjoyed our presentation.